I'd like to call the October 20th Benefits Cliff Task Force meeting to order. Madam Secretary, please call the roll.
Senator Neal. Senator Nemus. Senator Wheeler. Representative Bray.
Present.
Representative Stevenson. Representative Weber.
Here.
Co-Chair Howell.
Here.
Co-Chair Dixon.
We have a quorum. Have a motion to approve last minute meeting's minutes.
Motion.
Is there a second? Second. Been motioned and seconded. Do we have just an aye vote on that or no?
Voice vote.
Yeah.
Voice vote. Call it. All those in favor?
Aye.
All opposed? Missed that one, didn't I? All right, first presentation is for the cabinet. Secretary Freelander, if you and your people will come up. Appreciate you coming in and educating us today, and the floor is yours.
Eric Friedlander, Secretary of the Cabinet for Health and Family Services.
Carrie Banahan. Thank you. Carrie Banahan, Deputy Secretary, Cabinet for Health and Family Services.
Veronica Judy Cecil, Senior Deputy Commissioner for the Kentucky Department for Medicaid Services.
So you've asked us here today to present on the benefits, Cliff, and what we're doing and where we are. So I want to do a little preamble for you all about kind of just the general piece about where we are. Basic health plan, bridge plan, and we'll go into the recommendations of HJR 57 and where we are. What I want to kind of start with is this. We've looked at the recommendations. I actually reached out to Representative Moser just to make sure I understood, which evidently I didn't. So her concept, and this is the way I describe the difference. So you'll see this within the presentation. Her concept, of course, was to begin by using TANF funds. And it was also, how do we help employers purchase insurance, right, for their employees? And TANF federal funds really can't be used that way. And so what you're going to see is like how federal funds can be used, and that's the road we went down. So I just want to start with that, because I think employers, obviously we all support more employers offering plans for their employees, and that was the bridge from Medicaid. So it really is more looking at the private employers and building the bridge back that way, right, to Medicaid. When you look at the basic health program, it's kind of just, it's different, right? It will look more like Medicaid. And what does that intermediate policy look like headed towards full private insurance? And that's what we're going to describe for you today. But I also want to be really clear about this. Not a done deal, right? This is a part of the discussion. What we're going to present to you today is what kind of our best thoughts are, but just lets you know where we are. Not a done deal. There is no this is happening piece of this. I want to be just real clear in the beginning, because really we have to be in agreement. The General Assembly, there have been a lot of pieces. Don't move without the express written approval of the General Assembly. There's money in the budget for us to do it. So it's even a little confusing for us. So I'm just being straight up as I can. And so we've continued with the planning, right? But that's where we are. So it's all planning. Nothing's done. But this will be to just let you know where we are to this point. So I wanted to offer that as a preamble, because I know there's heat here, but I also wanted to just kind of acknowledge that and just be straight up about with where we are. So with that, as we say, we're going to go through the overview, we're going to go through the recommendations, and then where we are in terms of development, and then if we implemented, if we all agreed that was the right thing to do, then what those costs, and really kind of some of the timelines that we're up against. Just again, all out on the table. It's always best when everybody knows everything. So I appreciate you all asking us here. And that is the spirit in which we offer our presentation on the benefits, the basic health program. Gary?
Okay, Veronica?
Sure. As the secretary, I think alluded to, is that the basic health plan really is that bridge between Medicaid and the qualified health plan and commercial insurance available as people's incomes rise and as they're employed. So this is this sort of hybrid of taking some of the Medicaid policies and program, mirroring it with that of the QH of the qualified health plan that's on the state marketplace, and some of the commercial, which you generally find in commercial, and offering what really is kind of more an affordable healthcare coverage for individuals. Because what's happening is, as you have been hearing, is that people do get a raise as in their employment. And if they accept that raise, they immediately come off Medicaid because they no longer qualify. But then they are hit with the additional cost sharing that comes, and the increased cost sharing that comes with either a qualified health plan or an employer-sponsored plan. So it's really trying to help those folks make that change from Medicaid coverage. Generally, this is for people in the 138, so Medicaid covers up to 138%. So individuals over 138% up to 200% fall under a basic health plan. Some of these individuals are already eligible for a qualified health plan in the state-based marketplace. And so some of those folks who are qualified for QHP, qualified health plan, would move into a basic health plan if their income and federal poverty level income is eligible for that. You must be a citizen and lawfully present in the U.S., those individuals with what's considered affordable insurance through their employer do not qualify. So there is another filter in which you have to determine whether the person has access to affordability with their employer plan. So this just kind of gives you a visual what that looks like. Medicaid, there on the left of the slide, is for adults up to 138%. And then we cover some higher federal poverty level limits for children and pregnant women. But there is no cost to the coverage in Medicaid. The exchange plan, which is the yellow arrow pointing to the right, as I spoke about, is for those individuals above 138% and up to 400% federal poverty level. And those individuals are subject to premiums, co-pays, deductibles, co-insurance. There are subsidies, as you probably have heard. There are tax subsidies available to individuals with certain incomes, so that can help with the affordability of the qualified health plan. But otherwise, they are subject to those additional cost sharing. So the basic health plan is the green, and it's kind of showing you that bridge between beyond Medicaid and throughout the exchange to show you what really we could do for the individuals that are in that situation. And as we've spoke about, I mean, really the true need, we believe, for a basic health plan or a bridge type plan is to help those people that are moving from no cost sharing to more increased cost sharing. And being able to leverage federal funds to do that is also why the basic health plan becomes, a really good program to utilize. So this will help individuals that do see an increase in their income and then become no longer eligible for Medicaid, but can be put in the basic health program. And then something happens and they lose coverage, then they could more easily move over back over to Medicaid. So it kind of helps that continuum of people who we do see what we call the churn. As people do increase their income and decrease their income and have to move back and forth throughout the programs. The other piece to this is, as I mentioned, the use of the federal funds. It's a lower administrative cost to the state, and to be able to leverage a basic health program. So the way that a state is able to do a basic health plan is called a blueprint. And so we'll submit, it's similar to the state plan concept of Medicaid. We have a blueprint that we have to complete and submit to CMS for their approval. It will talk through what the program design is, so what benefits are included in the plans. It talks about cost sharing, premiums, co-pays. It talks about the agreement we have with the issuers. It talks about eligibility. So it truly is a blueprint. It walks through just exactly what the program looks like and covers all the pieces to it. So that has to be completed, submitted to CMS, and that process can take 6 months for CMS to review and get approval. Generally, what states have done is submit a draft blueprint, and then work with CMS and continue to work with stakeholders and others to develop a final blueprint that gets submitted for CMS approval. So I'm now going to turn it over to Deputy Secretary, talk about the HJR 57 work group.
So I guess next slide, please. So thank you. So the House Joint Resolution 57 passed by the General Assembly in 2021, and it directed CHFS to establish a work group to assess the feasibility of implementing a bridge insurance program, review TANF expenditures, and consider opportunities for private partnerships to better meet the needs of public assistance beneficiaries. CHFS engaged Milliman to perform a basic health plan feasibility analysis, which was presented to the group in August of 2021 and included parameters of BHP and state examples, overview of the implementation process, and estimated cost and enrollment numbers. Next slide, please. Thank you. HJR 57 findings of the current state found that Kentucky currently provides Medicaid coverage up to 138% of the federal poverty level. Increases in income for low-income families can result in a sudden loss of program eligibility for programs like Medicaid, and individuals with incomes above 138% of the federal poverty level are eligible for marketplace coverage, but oftentimes it's unaffordable. A basic health program can also be used to provide coverage for individuals between 139% and 200% of the federal poverty level. Federal funding is available for states for premium tax credits and information technology costs. States that do elect to pursue a basic health program do receive 95% of the amount of premium tax credit that would have been received for a plan on the marketplace. Next slide. Some of the rationale for implementing a basic health program is creating a basic health program will empower individuals who would otherwise lose their health care coverage through Medicaid to be able to accept work and pay raises and take away the disincentive to accept increased pay or work. The basic health program offers more affordable coverage for low-income individuals and improves continuity of care as the individuals are terminated from their health care coverage through Medicaid and transition to a BHP. So the task force made 5 recommendations. The first recommendation directed the Cabinet to implement a basic health program by July 1st, 2023. It directed CHFS to develop health plans under the basic health program that limited premiums and cost-sharing amounts with no deductibles. It directed CHFS to submit a plan for implementing the basic health program to the Legislative Research Commission and CMS by July 1st of 2022. It directed CHFS to work with KY Stats to refine and improve the Kentucky Benefits Cliff tool by September 1st, 2022, and directed LRC to continue the work group and focus on the child care benefits cliff. Next slide.
So just to give you all a sense of where we are, Right now,
Sorry, will you turn your mic on?
apologize. So to give you an idea of where we are right now, we did engage Milliman, who is our state actuary, to start developing rates for the basic health program. So what they do is they look at the qualified health plan rates, and they use that to help inform what rates could be for a basic health program. We also engaged Milliman to help us develop the blueprint, and that's what we are starting to work on. But most of the conversations that have been going on to date have just really been with the issuers, so the plans that would offer plans on the companies that would offer plans on the basic health program. Talking with them about what that looks like. Again, what's the benefits, what's the cost, who would be eligible, in particular cost sharing for the individuals that might be part of that. We are, if we are to implement something now, obviously we're not going to make a January 1, 2023 deadline. But if we were to look at a January 1, 2024 deadline, that means we would want to submit an interim blueprint to CMS by December of this year so that we could work towards finalizing a blueprint by May of next year in time for open enrollment for the 2024 effective year. That's what we've been doing. We've been doing a little stakeholder engagement, talking to some providers, but it really is early, is kind of infancy into the development of the basic health program and filling in the pieces of the blueprint. So this reflects what could, to our best estimate, be a cost for a basic health program. That first line, projected cost of coverage. This is based, again, Milliman utilizing previous qualified health plan information and Medicaid information that the best cost would be about $238.9 million. This includes based on 110% reimbursement for providers based on 110% Medicaid for providers. That would be a base, but obviously as what happens now, providers are able to negotiate rates directly with plans. So the funding that the state would get for the basic health program, the estimate we have is about $232.2 million. What that represents, as the Deputy Secretary mentioned, is 95% of the exchange premiums that's available for, in subsidies that's available for a BHP. This includes what would be in addition, we have on there what would be the out-of-pocket costs for members to offset some of the additional cost of the program. As we reflect there, that's $33 million. So this is premium and cost sharing, estimated as it notes at approximately 14% of the total cost. And then the available additional funds of the $26.3 million. These are funds that are an estimated 11% margin of total cost and could be available for increased provider reimbursement to reduce enrollee costs or enhance other areas of the benefit plan available. So these, again, are probably slightly dated just because we now have some updated 2023 qualified health plan information. It also just, as we dig into making decisions about cost sharing, premiums, and copays, that will also impact overall costs to the program. I think one of the most difficult things we've been trying to wrestle is how many people are we talking about as part of the basic health program. And so what we've been doing is tracking, as you all know, with the public health emergency, we've been providing continuous Medicaid coverage for folks. As part of that unwinding, we know that there are people that may qualify for a basic health program. And so we're talking probably about 35,000 people that could move to a basic health program. And then there are people within the qualified health plan that could, based on their income, if below 200%, could qualify for the basic health plan. So trying to estimate both going from Medicaid to BHP and from a qualified health plan to BHP, as well as trying to anticipate the uninsured that might be out there and take advantage of this opportunity. We've had a little bit difficult in estimating, but somewhere in the $40,000 to $75,000 range, not dollar, per, individuals. So that's kind of just our best guess for right now. And then we were asked what legislation might be needed. As of right now, we don't have any recommendations. We do have the budget appropriation, and that's really what we needed to move forward with implementation. But believe that right now there isn't anything else that we need. Some states have had enabling legislation to move forward on their basic health program, but it's not. Again, with the budget appropriation, we don't think that there's anything else that's specifically needed for our purposes. And that is the end of our presentation.
Thank you, and thanks for all your help. I know that there was a lot of extra work that went into that to get through Joint Resolution 57. Lots of estimates and guesstimates and projections to go in with that. I know it wasn't easy, but we appreciate. We try not to do this willy-nilly to just have extra things for you to do, but some of this stuff we really need to take a good look at, and you're our mechanism for doing that. I would open up for questions. I believe we have Senator Wheeler had a question.
I have a few here, Mr. Chairman, if you would indulge me. Now, it's my understanding on a bridge plan, is that for folks that are totally without coverage? Is that correct? Kind of to bridge the gap, is that the purpose of it?
So I think it could potentially be attractive to the uninsured, but really what we are trying to do is for people that are coming off of Medicaid because their income has increased even by $1. Is to make that healthcare coverage more affordable to them than what they would be charged for premium and cost sharing in a qualified health plan, which is where they would go unless they have affordable employer coverage.
I think I hate to do this to you, but there are multiple answers to your questions, and it depends on the individual. There are going to be some people that come from Medicaid, right, and who will have insurance, and that, like Veronica said, they make that next dollar and they lose Medicaid, and then what are they going to do? Sure. There are folks who are already there. They're already above 138%. They're on the exchange. They can't afford to get insurance. Now they're working, but their employer doesn't cover them. It's too expensive. So if we did the basic health plan, we'd reduce some of those expenses for them, so they would pick up coverage. There are others that may already have some coverage through the exchange, where we'd probably lower some of their costs. And then there's another group, and I think I'm covering all the groups. Mm-hmm. They have, through their employer, they have what would be deemed affordable coverage, and then they would not. That's the group that wouldn't come on. So I don't mean to make it more complicated, but it's kind of like you can think of it as 4 separate groups that might come on.
And that's a fair enough statement.
Yeah.
I agree.
Yeah.
One description doesn't necessarily fit
Right.
everybody. I guess if you're pulling people off of the exchanges to put them into the basic health plan, could that potentially lead to premium increases on those left in the exchanges?
That's one of the challenges.
Okay.
The answer is yes. Actually, the quick way to get to that is yes. If you change the mix of people, it will have some impact on premiums. No question.
And I guess would this also affect access to a particular doctor? Could you lose access to your physicians if you are pulled off of, I guess, the exchange and placed into the basic health care plan if your provider is not a participator?
That could potentially happen.
That's another potential. A lot of those panels are very similar. If you're the reason we were the way we described it, it'd be like the MCOs, and most of them are participating on the exchange. You'd move from that into the exchange, but if you were moving from the exchange into the basic health plan, you could have a different set of providers.
And some of the reason I ask this is, I mean, I know what some people refer to the big lie, but, I would call Obamacare the original big lie. If you like your plan, you can keep it. It's going to get cheaper. You can keep your doctor. I was not saying it's not resulted in some good things. It clearly has. And I have a lot of my constituents that, got laid off at the coal mines, that this was a godsend to them. Me, as a practicing attorney without my own company in the private health insurance market, I saw my family plan climb from $750 a month on an 80-20 plan with usually a $50 copay to the point it got up to almost $2,000 a year. And I don't go to the doctor but maybe once every 2 or 3 years. I'm a pretty healthy person. And then I got onto the state co-op plan, and then it went bankrupt. And, and even that, essentially I was forced into what I would consider high-risk insurance. I mean, I was paying $15,000 a year for insurance that didn't even cover the first $10,000 of my medical bills. I mean, I got screwed. I mean, I really did. And I was told that I wasn't going to, and I clearly was. And so I have a somewhat trepidation about some of these things as far as implementation of what we manifest, what something's going to do to people, when I think that the Affordable Care Act, Obamacare, was stated it's one thing, and to people like me, it became very unaffordable. I mean, I make a pretty good living, but I don't make, it was taking nearly 20% of my insurance to keep the plan I had. Was going to probably take 20% of my income to keep it to somebody that doesn't go to the doctor a whole lot. But I guess what I'm wondering is we talk about that the feds are going to cover 95% of this through tax credits potentially. How long is that going to last? Because obviously I think with Obamacare, Affordable Care Act, the federal portion went down over a period of time, leading the state to have to pick up more of the freight. So what are your all's estimates of the cost of this in the long term for a state that already has a somewhat strapped budget and $60 billion in pension debt?
Here's where we are. Last year, was it this year? The APTC was supposed to go down, right? And so there wouldn't have been the numbers that we gave you are the higher advanced premium tax credits.
It's the second lowest silver cost plan.
Right. So I'm just trying to, that those higher APTCs got extended by federal legislation, okay? And they got extended.
Enhanced subsidies.
Enhanced subsidies got extended
through 2025.
So the answer to your question is the federal dollars that we see in the presentations that we just gave you, they've been extended to 25. They were supposed to stop this year.
This year, that's correct.
So that's a real risk. You identify a real risk. So that is 25 unless it gets extended. Then that advanced premium tax credit goes down, and we'll have less money available to subsidize the plans.
But Mr. Chairman, how much will it go down if those aren't extended?
Do you know the estimate?
I don't know what.
Yeah. So
What was the
Well,
percentage though? It was,
we'll get that to you. Yes,
Yeah.
they increased it by.
but it's a significant percentage.
That to you.
It's a significant percentage, and we can get you that number.
Because I like providing coverage to people. I truly do, because I think things can happen. I don't think somebody should be declaring bankruptcy over medical bills.
Right.
But at the same time, Eisenhower always warned of a military industrial complex. I don't know that we don't have a healthcare industrial complex at this point in time in the United States. I lived in Germany for a year where everybody is required to have health insurance, and it did not operate at near the cost that it does over there. But I have to say they had some controls over there, like limiting the number of specialists per town that we would never tolerate in the United States. They generally do what they're told a little bit better, but still, I think we have to know the actual, long-term cost or potential, cost to the state before we implement something like this. Thank you, Mr. Chairman.
Sure. Representative Bray?
Thank you, and thank you all for being here. This feels more like a health and family meeting than a task force. And so I do have a few questions, and I really only had 3 till Senator Wheeler started. So I guess first of all, how is this going to impact anyone currently on private insurance? I know you had said that that there was the potential that we would have people within the marketplace now migrate to this, and there is the potential for premiums for those in the marketplace to go up because of this. Am I understanding that correct?
So between 138 and 200% of poverty,
Right.
if somebody had other coverage that was not considered to be affordable, and that's a percentage of income, they could take advantage of this plan. If somebody's currently on the exchange, between 138 and 200% of poverty, that's why you saw that 40 to 75,000 estimate, and they have coverage and they're getting coverage through the exchange, they could come on this plan and it would cost them less. The mix then of everybody else above 200% could change, which could affect those premiums as well.
Okay.
Is that
No.
Okay.
No, that's perfect. Is there any danger that somebody with private insurance would lose coverage because of this implementation of this plan?
I don't see
No,
how.
they should
I don't see
lose
how.
coverage? No.
Okay. And then, if it's all right, so one of the things that kind of concerns me most right now, particularly in healthcare, is our rural providers. One of the complaints I hear from my hospital is, or hospitals, is that the cost of care, isn't fully reimbursed from Medicaid patients, and they're so reliant on, our population back home is heavily populated by Medicaid patients. So even at 110%, will that cover the cost of care?
That is an excellent question. So a couple of years ago, General Assembly passed and we implemented something called HRIP. And what that is we, in concert with the Hospital Association and the hospitals in Kentucky, now through Medicaid, reimburse the inpatient at the average commercial rate, and we're asking for quality, and it's a program that's working really well and probably saved a bunch of hospitals. Rural hospitals, in talking with the Hospital Association, and we're with them on it, want to implement that same system on their outpatient side. If they do that, and you'll probably see this in the next legislative session, that will really help the rural hospitals with their Medicaid patients, because right now the inpatient goes, because it's inpatient, it mostly goes to the urban areas and less to the rural areas. Outpatient will flip that. And in order for this to work, right, the hospitals have to be on board. One of the reasons we got delayed last year, and just being frank, is that hospitals don't like 110% of Medicaid fee for service, right? They do much better under just straight up Medicaid. So that 138 to 200% of poverty, they wouldn't get reimbursed as well on either end of the scale. So they have concerns about it. No question about that. And that's just true.
Okay. One more question. Have any of the MCOs indicated that they want to adopt the plan, or that they like the plan, or has any of the private insurers agreed that this is kind of a good idea or a good road to go down?
I hate to say it this way, but to our face or behind our back?
Well, this is Frankfurt, so
So I think about three had said they'd probably join us, and I think
Three.
and there are three that didn't want to. But again, there are differences sometimes.
And keep in mind, some of that is because of the number of people, just, candidly, that would move from Medicaid to the BHP, or from a QHP to the BHP. So it's a small number for them right now, for some of them, and so the cost of standing that up and having that available. But as we've pointed out, I mean, one of the things that is really nice about this plan, if we can get the companies to offer Medicaid, basic health plan, and a qualified health plan, then individuals, as they move up and down that spectrum, can have the same company and then likely same provider, seamlessly transition. So, I mean, that's the goal. Would we get there for initial implementation? Likely not, because they have to make those business decisions as to whether or not they can really stand that up in the amount of time for the number of people that, they will initially have.
And then just one more comment. And I really do appreciate your all's candidness. And, I realize this probably isn't the easiest thing to talk about since it's all being drafted. And but just from somebody who's seen rural healthcare in action, mom worked for a rural hospital for 40-something years, wife currently employed at a rural hospital. We've seen the impact all across the state under the best of times. Our rural hospitals are struggling. And COVID, everybody thinks, well, these hospitals are just flush with cash, but that's not the case. I mean, the hospital back home, they've got a wing shut down because they're having to compete with bigger hospitals for employees, and it's killing them. I mean, travel nurses, we all understand the value in healthcare and healthcare workforce now. So just going forward, I mean, we can't keep asking our rural healthcare facilities and providers to operate at a loss when we wouldn't ask that of an insurance company or somewhere else. And so just thank you all for your attention to that, and just please keep that in mind going forward.
I have a couple of follow-up questions. One for Representative Bray's last question. In your discussions on this, have anybody discussed any alternatives to what you're trying to accomplish with BHP? There's one thing to just say, yeah, we don't like this, but if we're in a space where we are looking to do something and needing to do something, if there's any alternatives that we could move toward to kind of trying to find a middle ground on some key issues.
So I'll start with some of the alternatives that we looked at, and you'll understand why you like them even less than what I'm saying. One would be expand Medicaid up to 200% of poverty, and I'm for all the reasons you all talked about, right? There are certainly significant challenges to that. What we're describing here, the basic health plan is, what kind of waiver is it that we'd be asking? We would file this with the federal government if we wanted to do
A 1330.
a 13. So there's something called a 1332 waiver, which is where you kind of amend your insurance laws, right, to cover this between Medicaid, the whole population. For 1332, the APTC isn't really available anymore, so you don't get that funding from the federal government.
Right.
The other alternatives around incentivizing private insurers to provide coverage would look more like House Bill 499 this year, where some state funds, because it'd have to all be state funds, were put up for employers to be able to access to offset the cost of that health insurance. So that's the child care example, right? How much impact that would have? It would be more costly to the state. Those are, I think, kind of the basic levels of options that would be available. We're working with consultants. We're happy to bring them in. But as we went through with them what our options are, that's kind of the range of options that are out there. Is that fair, you all? Okay.
Thank you. Representative Weber, I believe, had a question.
Secretary Freelander, Deputy Secretary Banahan. One of the things I wanted to bring up is if we look at House Bill 7 that was passed in the 2022 session, Section 6 of that says, let me get it where I can read it. It says, notwithstanding any provision of law to the contrary, the Cabinet shall not exercise the state's option to develop a basic health program as permitted under 42 U.S.C. Section 180.051 without first obtaining specific authorization from the General Assembly to do so. With what I'm hearing today, with you proceeding forward on this basic health plan, how do you reconcile that with the language that was passed into law this past session?
Sure, and I know this is going to be an unpopular opinion. So that language is in House Bill 7. The budget that was passed in the end had funding for this in the budget. I'm not an attorney, so I'm not going to make any arguments here, but the perspective of the administration is, and I have it too, because I think the budget is like the biggest thing for the Commonwealth. It was last passed, and so since the funding is there, I think that is how we interpret the General Assembly's saying go ahead because the money's there. Now, again, I know we can disagree, but I'm telling you what that logic is.
Well, you also realize that we operate under a 2-year budget,
Yes.
So that would look into the future. And I think, I know you said that you had several opinions that would not be popular today, and obviously you've expressed them. I guess my concern with it is as I look at this and interpret it, House Bill 7 is pretty clear. The General Assembly may have appropriated money there for the implementation if as House Bill 7 says in Section 6, we choose to opt into the program and authorize the participation in it. I don't think that money included in the state budget compared to the language in House Bill 7, Section 6, gives you the authority to proceed with that. And I guess my frustration today is that's the problem that I have with this administration, is that they move forward in so many areas that they do not have the authority to move forward to. So I think the law is pretty clear. I think House Bill 7 is pretty clear, and I think you can reconcile House Bill 7 and the appropriation in the budget and not come to the conclusion that you can proceed forward on something that you clearly haven't been given the authority to do so. And I think House Bill 7 clearly outlines that. I know we're going to differ on that. That's my opinion on that today.
Certainly. Thank you.
If there are no other questions, again, I know this was not easy. It took a Herculean effort to grind through a lot of that. We appreciate this, and we may have some additional follow-up as we go through wrapping up our process for this committee. And we may be, maybe not in front of a committee, but may be reaching out to you on some of that as well. But
Perfect. We will look forward to that. Thank you very much.
Appreciate your time. Thank
Appreciate
you.
your all's time.
Next up, we have Kelsey Underwood and the rest of the Georgia crew for the Georgia Center of Opportunity. Come in and talk about this. If y'all will make your way up to this podium, please. As you start in, please introduce yourself for the record.
How do I get to presentation mode?
No, well, she's looking for
Oh, you want to go to presentation?
slideshow.
Yeah.
Click on slideshow on the top.
there.
Thank you.
slideshow.
Okay,
There we go. Yep.
now. Figures that the tech person would have issues with technology. Good afternoon, you guys. Thank you so much to this entire task force for letting us present to you today. My name is Kelsey Underwood. I am the product manager at GCO at Georgia Center for Opportunity, but I am a Kentucky native and I live here now, and I'm so excited to be here and to be discussing this issue with people that genuinely care about helping people in Kentucky. We also have our colleagues here. I'll go forward to this slide so we can talk about that and introduce everybody. This is my colleague Eric Randolph. He is our director of research, and he is the individual who has created all of the solutions and tools that you will see today. We also have our VP of Public Policy, Buzz Brockway, and our Chief Program Officer and General Counsel, Eric Cockling, who will be here to answer questions if you have any throughout the presentation or afterwards as well. So, really quickly, walked you through who we are. We'll let you know why this group from Georgia is here talking to Kentucky about benefits cliffs, because it probably didn't make a whole lot of sense in the beginning. And then we'll go through 2 and 3 pretty quickly, because I understand that you all have had a lot of meetings with people who've presented sort of ways in which to model the problem, and you have a deep understanding of what the issue is. So we're really focusing in on 4 and 5 here. We'll tell you a little bit about how we model the problem. We'll talk about comparing resources and tools, but then Eric is going to walk you guys through some of the state-specific solutions that we have, as well as how we might be able to help you guys reach those. So let's talk about this really quickly. And again, I know you guys have seen a couple of tools so far from other groups. So let's talk about how we do it and why that's important. First and foremost, our model for the Benefits Cliffs tool is computational. It's not statistical. That's important because it's objective. So the output here, and I'll show you what it looks like on our web-based tool, but the output here is exactly what it looks like at a federal, state, and local level for someone at each pay range who is on benefits. There's no question, there's no subjective information here, there's no opinion. This is how the law looks right now. And it's really important because what it does is it makes the magnitude of impact visual. So for the people you all are working with and trying to push this policy forward, it's important to show them the depth and breadth of the problem, and also to be able to calculate the delta between where we are and where we really need to be when it comes to helping people that are on our welfare programs. And lastly, our model is pretty straightforward. So it takes about 60 seconds to generate a scenario like this. And there's a reason that we made it that way, which I'll talk through here shortly, but really quickly, I'm going to show you what it looks like. I've pre-populated this just to keep it simple for you all. And in the interest of time, we have 10 states on our model right now. We'll have 12 by the end of the year. And we do update that annually, hopefully more often here in the future. You can look down to the county level on every piece of data that we have. And then all you have to do is enter information about children. And really, we only need their age, gender at birth, their school status, and their disability status. Child care and rate category, a lot of people don't know that unless you're working directly with an individual, so like a caseworker or something like that. And even then, some people are not sure about it. So we have values populated in there that will still get you a very accurate result. And then with adults, we have mom and dad right now. We're actually moving towards more of a caregiver model. So early 2023, we'll have the ability to add grandma and grandpa, foster parent, kind of those atypical family situations that are very typical for people in these communities. So for the purposes of this, we've got a couple of kids, single mom in her 20s. She's not married and she's not pregnant. And then I always leave the housing and childcare additions on here because you can actually take them off in the graph. The graph is dynamic, so I'll show you what that looks like here. So on the bottom, you've got your annualized income, annualized hourly pay, essentially. And then on the y-axis, you've got their total take home with all these programs. Probably similar to what you all have seen before, but it is interesting. You can hover over any point on this graph. They're all 25-cent pay increments. And you can see what their top line income is, as well as the value of every single program that they would be, or the value of money that they'd be receiving from every single program should they be on that program at that pay rate and given their family scenario. Another interesting thing is, give me just 1 second, we'll make this a bit smaller here. So it's dynamic, like I said, so let's pretend that they're not receiving childcare. You can take that off. Maybe they're not getting cash assistance. We can see what that looks like, food, etc. So really it allows you to quickly and efficiently model different scenarios when you're looking at creating solutions. And I'm happy to go over that in more detail in the Q&A time, but I just wanted to briefly let you guys know what it is that we're working on. So when we say build with the end user in mind, in a perfect world, we thought that the people on benefits would want to use this. What we found is that that was actually an inaccurate assumption. It's not all of them, but most people who are in the welfare system are not interested in using a tool like this, but the people that help them and the people that work with them and for them, like yourselves, are. So my job as the tech person on the team is to put myself in your shoes and say, how do I balance customization and granular information with efficiency? Do you have time to run a 10-minute scenario every single time that you want to look into this? Probably not. So that's why we distilled our information down. It's still very accurate down to the dollar level, but it's not 10 pages of information that you have to fill out in order to get that result. But we do have, and this gentleman created it, he's absolute genius and expert in this, created a detailed model that powers this website. And that is available to every single person that uses our tool. So we have a lot of people, for example, there's a PhD student in Michigan who's using it right now for his thesis, or his dissertation, sorry. We've got people in North Carolina using this, people in Arkansas using it, people in South Carolina using this, multiple states, whether they're a nonprofit organization or policymaker. They are using the detailed model as well to run specific reports, do specific studies, things of that sort. So the detailed model that powers this website has all 18 programs that we include, has a couple of other inputs and variables, so you can get very granular with it if you'd like to. And then lastly, collaboration and competition. So one thing that's really important to note, because we have a technology, is that we are not a technology company. We are not interested in outselling or outperforming anybody. What we're interested in is getting real results for people as quickly as possible. And that means that we'd rather work with people than compete with them. So if there's somebody in states that we are entering in, we would rather work with them, like the Atlanta Fed. We work with them quite a bit in Georgia, to get quick access to this data and pull it into our model. So speaking of collaboration, here's kind of where it becomes important for groups like yours. All the states in green will be live by the end of this year on our website. 10 of them already are. Utah and Missouri are coming here shortly. West Virginia is inking their paperwork today, which we're very excited about. And all the states that are in red, we've spoken to, presented to, or in conversation with adding to our model, whether we've spoken with policymakers or organizations. Why this is important, and I'm sure you guys have deduced this, is that Eric is going to talk about what we can do in Kentucky today. And that's incredibly important. But on the federal level, there's a lot of change that needs to happen. And in order for that to happen, there needs to be a movement. There needs to be multiple states that are working on this issue. So in these 12 states, these 1,100 and some counties, you've got counterparts that care about this, that are working on this, that you can collaborate with, we can introduce you to, so you can see what's working, what's not working, what have they tried, what have they not tried. You can compare their model to yours on our website or in our Excel model as well. And it covers about a third of the US population, so it's pretty indicative of what's happening in our country, although we would like to have some of the less conservative states on here to get a better picture of what that looks like on the whole. And then it does represent 95% of federal funding. So again, we've got 18 programs and other inputs that are in this model in order to create the best picture possible. So before I pass it over to Eric, where he's going to talk about specific things you can do, I do want to highlight that there are non-policy things that we also work on in order to address this problem at the ground level, because policy is the ultimate goal. However, people need help right now. So we do work with nonprofits. We have several employers that we've spoken with that want to understand how they can leverage this information to better serve the people that work for them or that they work for. So with that, I'm going to give it over to Eric, and he's going to talk about what we can do right now.
Hi, thank you for inviting us. Thank you, Senator Howell and Representative Dixon and the entire task force. So we actually have a written testimony that we had submitted, and we actually outlined a number of ideas in that testimony. So I don't necessarily want to go like word by word of what we have in the testimony. What I want to do is maybe just highlight some of the things, and then at some point we can move to questions, and you can grill me if you want. But at any rate, we have one thing I want to kind of say at the outset, and I'm sure that many of you are already aware of this. There are pilot programs, demonstration waivers already embedded in federal law. So there's a lot of opportunity already that all states, including Kentucky, can take advantage. I heard from the last panel they mentioned Section 1332. That was part of the Affordable Care Act, and then Congress inserted a provision that provided a very flexible waiver program that would allow states to reconfigure how they do health care. And in fact, Georgia has a proposal that is in the courts, but the courts ruled in favor of Georgia because the current administration had nixed it after the prior administration approved it. But it is very flexible, and I would encourage you to kind of look at that. We actually have a paper on some sort of systemic kind of healthcare reform, and that's just another option you might want to consider. There's also in the SNAP program. So in SNAP, there's a Section 2026, and that allows for demonstration and pilot programs. And so it specifically says for welfare reform and for help individuals to reach self-sufficiency. So those are two specific conditions that they place in there for what these waivers may be. And if you kind of look at the SNAP program, there are things I believe that can be done to actually address some of the benefit cliffs that you see with the SNAP program. And we're concerned. I just want to say one thing. It's mentioned briefly in the testimony. We're concerned about the benefit cliffs that you're concerned about, where you see from additional earnings you have a cliff. But there's also, if you will, there's marriage penalties. That's also kind of a benefits cliff. And so the food stamp program, and a lot of the programs have both. They have a component that's in earnings, and they have a component that might be a marriage penalty. Sometimes it's one and the other, and sometimes programs have both. But in the case of the SNAP program, there was during the Families First law at the beginning of the pandemic that was passed, Congress created the maximum allotment program that basically just placed a benefits cliff across the board. And any household on the food stamp program had a benefits cliff, and a major one. Like a household of three, I think it came out to about $6,000 a year. The actual numbers are in the testimony. That was something where states could opt in as a waiver, and Kentucky opted into it, but thank goodness they came off of it in May. Still, though, there are 30 states on that program. But that was a case where I think that states should look at that before you say, oh, we're going to participate in a waiver. Maybe look at it in a degree to see, did this actually make benefit cliffs worse or better? At the same time, why not take advantage of the Section 2026 waiver and see what can be done now? There are two things that we've identified in our modeling that are specific food stamp related cliffs. One is the way that you do the calculations for the benefits, and there are these what you call these income disregards. It's getting a little bit into the detail, but that's where you actually generate the cliffs. And so it's like a cross subsidization of other welfare areas. And so one of the things to limit for this particular program would be to change how those income disregards are calculated, and that possibly could be for a waiver, because it would meet those conditions. Of course, it would require federal approval. There's also, I'm jumping a little bit ahead. There's also, we also recommend trying to work with Congress. We actually have an effort now. We're collaborating with two different think tanks, one in Texas and one in Louisiana. And we actually have some legislation that we're going to have introduced in Congress to handle some issues for us. And there's no reason that as we identify different federal legislation that could be changed, that we can work for that as like a longer term solution, perhaps, or if they pass it more quickly, maybe a shorter term solution. But that's in addition to things that states could do now. I'd like to also point out that in addition to waivers that are available, there's also block grants. And block grants are less restrictive than the other programs. And one of the big block grants is the child care program. So in child care, what we've discovered is, it's one of the largest areas where you see benefits cliffs. And these are the kind of benefit cliffs where a single mom or a single dad will give up a better paying opportunity. We know that anecdotally. We hear that all the time from employers and others. But one of the things we know as we're doing the modeling with the child care, since we now have we actually have 11 states in, and we're coming up with 12 in the modeling, that the amount of the benefits that you give is a major condition that creates the benefits cliffs. So kind of the national trend is to push families into, higher quality settings. But there's a trade-off. The trade-off is that it costs more money. So we believe that one of the things that states can do now is to look at their plans for how they actually run their child care program. And then with the understanding that the more costly you make it, the higher that you make these cliffs. So there needs to be attention given to how can we make the child care program so it's not as costly. And one simple way would be to incentivize the parents to choose less costly settings. And that might be, instead of having them go into a center, you might have like a family member. So a lot of states would have like various tiers of the child care setting. Like the one tier would be, for example, child care center, and then maybe another tier would be, a family setting. So you might have a grandmother or a trusted relative who will look after the child as opposed to a setting. Now, in that particular case, you pretty much eliminated the benefits cliff to that program. There's actually other ideas that we've worked at around the child care. There's ideas of even trying to work directly with employers, to have employers provide it. That would work with larger employers, mostly, not small employers. So that's the case for the restructuring of the child care block grant. The other thing too is, I think Kelsey had mentioned this briefly, that as we're coming up with different ideas that we want to pursue systemic reform, or we want to go before Congress. So the more that we pressure our our congressional delegations, the greater chances will happen. And just as a case study, the welfare reform of the 1990s, the TANF program was basically bubbled up from the states. You had Wisconsin Works from Governor Tommy Thompson, and then that got the attention, and then you had a Republican Congress and a Democratic president that signed it. There's another thing I think I need to mention before I stop here. You could stop if you want, but I have a couple more things. So the one thing is that we actually have a 3-part series on systemic reform, which is kind of like a big picture. It's like this is where we dream we would like to be. But there's a piece of that we are actually aggressively trying to get actually in Georgia, and we think that other states like Kentucky can benefit for something like this. So we believe that you need to kind of integrate workforce development with safety net programs. And the more that you can do that, the better it will be. And you can actually help individuals overcome benefits cliffs because you're actually helping them with upward mobility. So there is kind of, we don't see this as, employment versus incentives. We believe you need both. You need to promote employment, but you also need to align the incentives for earning more money. And so what we have is for Georgia, we're working on the idea, and we've talked to individuals in the governor's office as well as state legislature. And Buzz Brockway here can give you more detail if you want to ask him about that. But it's like creating a Department of Workforce Services. Utah currently is the only state in the country that does it this way, but they also have some of the best metrics when you kind of look at the metrics of performance. But the whole idea is that someone comes in and they need help maybe with some safety net issue, and then what it is the central activity is actually employment. So you're really helping people to move up some sort of income ladder so that they could become more self-sufficient. So that's something that we're doing that. And there is one kind of hiccup in that where there is the federal legislation for the Workforce Innovation and Opportunity Act, WIOA. If I say WIOA, that's what I'm talking about. That there is one thing in there that only allows Utah only allows you to have a totally fully integrated system, but you can still write the legislation so there's a trigger thing, so that when the feds actually amend that, you can have it trigger and it comes right in. But you also can put all the pieces together. There's no reason why states can't kind of move toward that kind of a vision, like what we're actually trying to pursue. So I'll turn it over to Kelsey. Oh yeah, I forgot. Thank you. I forgot. Yeah. So we. Yeah. Okay. So I'm looking at the two chairmen. We actually have a smoothing tool that's part of it. It's like a 3-minute video. Would it be okay if we actually just kind of show it? Just kind of goes over how the smoothing tool works with our thing. Would you be interested in seeing that?
Yeah, can we hold that for a second?
Certainly.
If we have somebody after you, I want to see how it goes now, and we need questions. If we have time at the end, I made a note, and we'll revert back to that. I just want to make sure we're respectful of everybody's time.
Okay, thank you.
Excellent. So we'll close really quickly in the interest of time. What could we do as GCO to work with you all to address these issues, hypothetically speaking? The first thing would be to integrate Kentucky into our data model. So bringing you all on as the 14th state would be fantastic. I would love nothing more than that. And then facilitating connections with other states that are already in that model, or that we have connections with that maybe aren't in the model. We do talk to people in other states that we haven't yet integrated, that we'd be glad to introduce you to if you're looking at collaborative efforts in that case, or just in looking at, again, what's worked and what's not worked for other people. And then lastly, we took a look at what some objectives were for the task force. One of them is a calculator, which we've covered. And then another one is a job search tool. We're not going to belabor that. That's not the point of this conversation. But just to let you know, if it is of interest at a later time, we do have a job search platform that has been extremely successful in Georgia. And it is targeted specifically at the population that is impacted by benefits cliffs. We have, I think, like 85 employers that we're working with right now, and we've had several hundred people, probably 600 people that have applied through it, and several that have gotten jobs. So we can talk about that at another time, but I just wanted to highlight that because I know there's a lot of boxes you guys have to check. And with that, we're happy to answer questions. I'm actually going to give my seat up to these gentlemen because they probably know more than I do about the questions that you have. So.
Thank you. Anyone have any questions on any of this? Chairman Dixon?
Yes, thank you, and thank you for the presentation. That was very informative and a lot of good information there. I do have a specific question on the work program that you brought up at the end. And the reason for that is I had a piece of legislation that was a pilot program for a work program that tied a benefits cliff calculator and the benefits together as a pilot program. So with that, if you can supply the committee or the task force with any information that you have on those type of programs, on the efficiency, the effectiveness of those programs, and you had spoken that you have 600 people or so sign up for a program similar to that in Georgia, that information would be great for us to have and to see, because I agree with what your statement and what you said in your testimony. I think that through workforce development and some of these benefit cliff issues, those coupled together can make some substantial benefits for those individuals who are motivated to continue on with other changes that we brought up in our task force. So I appreciate that, and look forward to if you could send that to us so we could go look into that further.
We would be happy to supply that.
Thank you.
Anyone else having any questions on this? I just want to thank y'all for coming today. We talk a lot about the what and what we need, but the how on how to get there, the devil's in the details, so to speak. And this has been really one little question I had, and maybe this is something we could talk about afterwards if you wanted, is how far along are you in Georgia? I appreciate y'all sending that information. I did kind of a dive into some of the things that you were doing. So if anyone just wants to touch briefly, there's a lot of similar demographics in certain areas of Georgia and certain areas of Kentucky. And I just thought it might be informative to have a little brief talk about that.
Yeah. Thank you for the question, Senator, and appreciate y'all letting us come and talk. I served 8 years in the Georgia legislature, and while I was there, coming out of the Great Recession, so to speak, we noticed that our urban areas, our metro areas, were recovering kind of nicely. Our rural areas were not. And so the Speaker of the House at the time formed what he called the House Rural Development Caucus, or Council rather. And it traveled the state, a group of legislators that traveled the state, meeting with local officials, talking to them about what they needed, how they could spur economic development in their communities. And every year they bring pieces of legislation based on that recommendations. But they began hearing from employers all across the state that were trying to figure out, how come people work 3 weeks out of the month and then quit? How come people work 30 hours when I need them to work 40 hours? And over again, it was coming back that there were these folks dealing with these cliffs. So we've presented before that committee a number of times, talking about some of the issues. What's excited Georgia the most is what Utah has done, and their full integration of the delivery of workforce development services and safety net services, and placing work really at the center of that, because it gets you around all the fights that people have and the disagreements that we all have, and the court stepping in on where you can impose work requirements and those sorts of things. If you put work at the center of it, and the moment that somebody comes in to seek assistance, it's immediately talk to them. Hey, are you aware that these job training programs are available? What's your job situation? How can we get you into a job or into a better job? That's what people want. They want to be on that path towards self-sufficiency. So Utah's really done an amazing job with that. Eric mentioned federal law kind of prohibits the rest of us from integrating that fully, and that's why we're kind of pursuing a two-track situation. As Eric mentioned, we are working with a member of Congress. I won't say it publicly because he hasn't dropped the bill yet, but we're very hopeful that after the first of the year, he'll drop a bill that will fix that. So what we really need is states to come along and say, yeah, if Congress does this, then we want to take advantage of that. And that's what we're working on in Georgia. There's a lot of interest in our governor's office, a lot of interest in key members of the House Rural Development Council to do this. Georgia's already began bringing all of their workforce development programs under one roof. Our Department of Economic Development, that's what the governor chose to do. So he's consolidating those programs. We're working with them to, all right, let's consolidate, let's bring all of the safety net programs under one roof so that start to streamline the operations of that. So that's what we're working on the state level. At the same time, trying to put pressure on Congress, give states this authority, this flexibility to fully integrate the delivery of these programs so that everybody can do what Utah has done. So that's kind of where we're at right now in Georgia, and I hope that answers your question,
Yeah,
Senator.
thank you for going into that a little bit.
Yeah.
We're kind of on pace right now.
Yes, sir.
We have the link that you were talking about for that video, and we'll distribute that amongst these members of the committee so we can review that then. And we appreciate it. We appreciate your time coming up here from Georgia, and thanks for coming up. Thanks for your information. Next up, we have Lisa Dennis and Cabinet talking about our Transitional Assistance Program in Kentucky Works. please come up, introduce yourself, and get started when you're ready.
Hi, good afternoon. Good afternoon. My name is Lisa Dennis, and I am the Deputy Commissioner for the Department for Community-Based Services.
Good afternoon. I'm Todd Trapp. I'm the Director of the Division of Family Support in the Department for Community-Based Services.
Good afternoon. My name is Laura Began, and I'm the Regulation Coordinator for the department. And thank you for the opportunity to present.
So we are here today to talk about KTAP and KWP, the current status of these programs, and the proposed reg changes. The Kentucky Transitional Assistance Program, known as KTAP, and the Kentucky Works Program that we refer to as KWP, are 100% funded through federal TANF funds. In 1996, Congress created the Temporary Assistance for Needy Families block grant through the Personal Responsibility and Work Opportunity Reconciliation Act. And through this block grant, Congress also introduced the 60-month lifetime limits on these benefits. In order to receive the full amounts of TANF funds, states must also contribute maintenance of effort dollars. And the four proposed purposes of TANF are to assist families in need, so children can be cared for in their own homes or homes of relatives, to reduce dependency of parents in need by promoting job preparation, work, and marriage, and prevent pregnancy among unmarried persons, and encourage the formation and maintenance of a two-parent family. You see listed here the federally allowed uses of TANF funds, which include basic assistance, work, education, and training activities, child care, non-recurring short-term benefits, work supports and supportive services, fatherhood and two-parent family programs, child welfare services, program management, the refundable tax credits, pre-kindergarten, Head Start programs, the transferred to social services block grant, and out of wedlock pregnancy prevention. Kentucky uses our TANF funding for the top 8 initiatives you see listed here on the screen, and each year every TANF dollar is obligated for these top 8 items. Adjustments are made each year between state MOE and federal funds, depending on the state's budget situation. But that's why the TANF flexibility is vital to the department. And remaining TANF funds are rolled over to the next year and quickly spent. Federal eligibility requirements for TANF programs are listed here. Individuals must reside in the state in which the individual applies. They must be a U.S. citizen or legal immigrant with some restrictions. Federal law prohibits TANF funds being used to assist most qualified immigrants who immigrated after 1996 until they have been in the U.S. for at least 5 years, with some specific exceptions. This applies to monetary assistance, but also applies to supports and services that we'll talk about a little later in this presentation, that include things such as job training, transportation, child care, and no funding from these programs can be used for individuals without documented immigration status. Individuals also must be unemployed or underemployed with a low income, and one-parent households must participate with child support and have a child 18 years of age or younger, be pregnant, or be 18 years of age or younger and the head of the household. Federal law requires TANF participants to assign their rights to child support to the state, meaning that the state can keep the money it collects from non-custodial parents to reimburse itself and the federal government for the cost of providing cash assistance. Participants are also required to cooperate with child support enforcement or have their benefits reduced or taken away. And then last week, the Kinship Families Coalition of Kentucky presented to a legislative committee and mentioned this as one of the barriers relatives have identified. Many grandparents and other non-parental caregivers receive KTAP for the children they are caring for. One of the requirements of KTAP is that the relative caregiver has to try to get child support from the child's parent. This presents more hoops for the relative caregiver to jump through and can also create tension and even animosity between family members. The Kinship Care Coalition also mentioned that KTAP rates are so low, and we'll talk about that a little bit further in the presentation, that it's difficult to cover a cost of attorneys, keeping an attorney on retainer. And then again, also state law requires public assistance recipients to assign child support rights to the cabinet as part of eligibility.
Right, so Lisa told you a little bit about TANF, the requirements about it, and now I'm going to go into a little more detail about these programs that are funded with TANF that we are presenting on today. So the Kentucky Transitional Assistance Program provides financial assistance for needy dependent children, that's key federally, and their households. There is a 60-month lifetime limit that was mentioned, and the payment is based on family size and income. Parents who are participating in KTAP are the poorest parents in the state based on income thresholds that hover around 25% of the federal poverty limit. We will get into this a little more in the presentation, again with those income standards. For the Kentucky Works program, the goal of it is to assist work-eligible individuals in supporting their families through self-sufficiency. This program is available to KTAP participants. It provides training and job-seeking assistance and support services that, again, we'll get into a little bit more in detail, but things that are necessary for school and work. The federal TANF law requires states to meet the work participation rates targets or face a penalty. A state's work participation rates measures the share of work-eligible participants who are engaged in work activities as defined in federal law. So states must meet an all-families rate and a higher two-parent families rate. For a state to meet its all-families rate, 50% of the families receiving TANF cash assistance must be engaged in a work activity for at least 30 hours a week, 20 hours a week for single parents with children under the age of 6. States must also meet the two-parent family rates by having two-parent families generally work for 35 hours per week. And you heard Lisa mention relative caregivers. This is nuanced a little bit for non-parental relative caregivers receiving KTAP for children in their care. Because Kentucky's TANF caseload has decreased significantly over the years, we have a caseload reduction credit that gives us some flexibility in those work requirements, but I wanted to let you know those are federally required. And KRS 205-20031 requires the cabinet to promulgate administrative regulations to develop a work program for recipients of public assistance to provide for immediate employment or preparation for employment and to provide supportive services to assist in the pursuit of work and self-sufficiency. So this is fulfilled through this program, Kentucky Works program. We were asked to provide some current program stats or the status of these. Since the creation of TANF in 1996, there have been dramatic declines in the number of families receiving this assistance nationwide. Again, it was created through the Personal Responsibility and Work Opportunity Reconciliation Act, part of the Welfare Reform Bill. So the purpose of it was to get families back into work. Even through the COVID-19 pandemic, TANF utilization reached a historic low. TANF's early years witnessed unprecedented declines in the number of families receiving cash assistance, and those have continued to decline, those rates. So since TANF's creation, the national caseload has declined by 76%. Because the program reaches so many fewer families than the predecessor to TANF, Aid to Families with Dependent Children did, it provides families substantially less protection against poverty and deep poverty because, again, remember, this is for some of the poorest in the state. Despite precarious economic conditions, many families, again, didn't utilize KTAP services. Nationally, just 21 out of every 100 families in poverty received TANF benefits in 2020, compared to 68 out of every 100 in 1996. And 14 states reached 10 or fewer families for every 100 that were statistically in poverty, and those stats are according to the Center of Budget and Policy Priorities. So currently, we have an average of 10,342 families receiving KTAP assistance monthly. I provide that breakdown there. It's about a little over 3,000 adults and over 17,000 children. This is where we kind of get into relative non-parental caregivers again, because they can opt to select child-only KTAP. So that's why you see such a large discrepancy. There are caregivers receiving assistance only for children such as grandchildren that they're caring for. Also this year, TANF-funded child care assistance was provided for an average of 770 children per month. So TANF can, again, pay for child care services for children that are eligible for this program. And other support services, again, back to that decline in utilization, have been provided to less than 10 individuals on average monthly. You'll hear a little bit more about that program, but those support services are eligible to those in the Kentucky Works program, which are, again, KTAP recipients. So you may be asking, what is the cause for these updates? House Bill 50, so my work is in regulations, and even though this bill passed 5 years ago, many people in regulations we remember what it was because it was a pretty big deal. It was a red tape reduction measure, and it included that regulations that haven't been updated in 7 years would expire. They would just go off the books on that 7-year date. From the changes that we're going to discuss, 9 out of 11 of the administrative regulations affected were up for expiration as of November 18th of this year. So when an agency has regulations that are expiring, they have 3 options. They can say that a regulation is up to date. We can certify that. We can certify that a regulation is outdated and needs amending, or we can certify that a regulation is outdated and in the process of being amended. So for these administrative regulations, we'll get into the need for updates a little bit, but much of the language of these regulations and the amounts provided through this program are 1990s level. So we really could not certify that they are up to date. A lot of the language of the regulation is from even the program before TANF in 1996. So we certified that updating was needed and that we would undertake that. So we had to amend 9 of 11 of these administrative regulations anyway. I don't have it here in the slides, but also with the mention of House Bill 7, House Bill 7 included that we were required to include some language around the recoupment of benefits. So we had to open some of these administrative regulations to meet that deadline. That deadline was October of this year. So we had those 2 factors requiring us to open these administrative regulations. So we took a good look at them and tried to address some of the dramatic declines in them. So we're going to tell you about some of these changes. These regulations were filed. That really just kicks off the promulgation process, this long regulation process. These regulation changes, what you're going to hear about, they're only proposed. They still have a long way to go. They're still in the public comment period. Then they'll undergo legislative review. They'll go before 2 legislative committees before going to effect. So I just wanted you to know that what you're going to hear about is proposed. We present on TANF almost annually and other block grants that we administer mostly to the Health, Welfare, and Family Services Committee. And we've been asked before about how these assistance programs help single-parent families compared to 2-parent families. And we've been tasked with thinking about how we could assist 2-parent families more. And so you'll see that we've undertaken that in these changes as well. I mentioned we've increased the benefit amounts. They were from the 1990s. And addressing the benefits cliff. So a couple of the changes that we've proposed include increasing the resource limit of KTAP program participants. So they would be able to have an increased level of asset savings and still remain in the program. And we have proposed increasing income deductions, which you heard a little bit about before. So just allowing program participants to make a little bit more money and keep a little more in savings before they're ineligible for the program. And again, with this task force, it's a great time to talk about other potential changes that we can make for the benefits cliffs. So, turn it over.
All right. So I'll just, I guess, restate the point Laura made, that these are all still in the review process. So
excuse me, can you either
comments.
sit a little closer to it or something? We're having trouble picking you up for
Yeah,
the
I'm
record and
sorry.
everything. Thank you.
I did turn it on, so. That's right. Step one. Okay, I was just saying, again, that these are still open for comment, so certainly we'll welcome those and any ideas as we go through this. So I get to talk about the good stuff, and that's how we're changing the program, some of the changes we're making to help these families, both single parents and two parents. One of the changes is eliminating deprivation factor. In the current program, to be eligible, if it's a single family, then it must have an eligible child that's deprived of support of the absent parent, whether that's due strictly because of absence, the death of one parent, incapacity, in the case of a single parent home, or if it's a two parent home, it would have to be unemployment or incapacity. It has to be deprived of support for one of those reasons. We're going to eliminate that. Essentially, that's more of an administrative barrier than anything else, because generally, you're tracking down proof of those reasons, right? And so it's really going to be a lift on the workers and a lift on the two-parent households especially. It will allow some larger portion of them to be eligible. So that's a really good thing. And then, let's see, I think we're ready for the next slide. The other thing we're going to do is increase the KTAP benefits. The slide here shows what the current maximum payments are. And I think Laura said it's been a long time since these changed. I think one of them has changed. I became a caseworker in 1990, my first state job. I was an eligibility worker in the field, Jefferson County. And so one of the first things I learned was AFDC policy and how to work a case doing that. These, like I say, I think the lowest two have increased. And that was in the mid-90s. And since then, none of these have increased. And so it was high time for that. So we're doing that. And then I will reiterate the point about the relative caregiver families. This payment scale applies to them too. If it's a child-only case, that's how we refer to those, because the parents, there's no adults in the benefit group, is the reason for that terminology. So here are the proposed increased amounts. Essentially, we're doubling the payment amounts across all household sizes. So I think that's a really good thing. I think it'll help those families who are eligible. So the next part of that, we can increase the payments, but if we don't increase a couple of other factors, then nobody will be eligible for those payments because of the way the calculation happens. So there's two steps to that. One of those is the standard of need, and basically that's a number used to determine. It's based on household size, and it's used to determine the amount of money someone or a household would need to pay their bills, and so this is the current amounts, and what we propose to do. Actually, can we go back? Mm-hmm. This is the standard of need and the gross income scale. That's the second part there, and actually I've got them backwards. The gross income is the first thing we check. And then the standard of need we use to compare to their actual countable income. And so if we don't increase both of these things, then, as I said, nobody would be eligible for those increased benefits. So next slide, please. And here's where we're going with the standard of need. And you can see, let's see, is it both of them? Yeah, but it's basically a 20% increase across all household sizes there. And then, let's go to the next slide there, Laura. Oh, I'm sorry, back up one. I need to look at my notes, don't I? So, and here's the gross income. So as I said, it's 2 steps. The first step is we do a calculation of earned and unearned income for the household members in the household, and then there are certain things we can deduct. And so once we arrive at a gross countable income, we compare that to the gross income limit. If they're below that, then we go to step 2 and we compare it to the standard of need. If they're below that, then we do a calculation, and either the household is eligible for the maximum benefit amount for their household size, or through rateable reduction, we determine the benefit level, which would be something below that maximum payment. So now I'm ready for the next one. All right. So another piece of this is the resource limit. And we're increasing the resource limit, or we're proposing to, I should say, increase the resource limit from $2,000 to $10,000 per household. A big part of this is, what the folks in front of us were talking about, the benefits cliff, right? Because this allows folks, I mean, if the only thing they can have in the bank is $2,000, as soon as something bad happens, that money's gone. We all know that, right? So if we can let them get up to $10,000, that's a little bit more, and they can survive, maybe between jobs a little bit longer than they could otherwise. And maybe we won't have to see, the safety net won't have to be there for them, I think, is what we're hoping for. So let's see what else we have here. I will note that this increase is something that a lot of other states have done in the last 2 years. I think Connecticut, Illinois, Maine, Nebraska, New Hampshire, Ohio, South Carolina, and Texas, they've all done this already, or something similar to this. So I think it's good for us to follow suit on that one for sure. Some of the other things that we're changing, first thing, increasing assistance for short-term employment. We have a deferment program is actually what it is, and it's a program that defers or diverts someone from monthly assistance by just helping them through a short-term need. The current amount of that program is $1,300. We can help with that. We're proposing to double that amount, and we're proposing to make it available. It actually would cover. It can be available for 3 months, but then beyond that, they would not be able to obtain it or be eligible for assistance through that program again for 12 months after they get it. And that, as I said, is really helpful for any short-term unemployment or anything like that. We're going to increase the work incentive for households discontinued from KTAP. Currently, that program is 9 months. We're going to extend that to 12. That should help with the benefits cliff as well, because if a household, if their KTAP discontinues due to earned income, then they're eligible for that, a payment for 12 months after that, as long as they retain that employment, and we verify that. So that's been a really good program, and it'll be great to be able to increase that. And then relocation assistance. That is a program where if somebody needs to move for a job, or we're also adding in there if they need to move to escape a domestic violence situation, and this would be a KTAP recipient, then the relocation assistance program can assist with that. And so if they have an offer of employment but it's too far for them to drive, we can help them move closer to that, so that they can take advantage of that. And then this last one, simplifying school attendance paperwork. Essentially, school kids used to be able to just drop out at 16. They can't do that anymore, and so there's no reason for us to follow up on that. So that's one reason we're making that change. That'll just be a lift on the school systems and on us administratively. So.
All right, and I'm going to tell you a little bit about changes that we have proposed in the Kentucky Works program. So again, we are required to make available and administer a Kentucky Works program, both federally and by state requirements. So the Kentucky Works program is really just a program to assist individuals in obtaining and maintaining work. Currently, we offer transportation assistance, and all the things here you're going to hear me talk about are directly linked to obtaining and maintaining their employment, and that is verified. So transportation assistance, they can currently receive up to $200 per month, say for bus fares, for example. We're increasing that to $300 per month. There are lower amounts if there are like only a few days a month where transportation is required. We are also proposing to increase supportive services, and this is what I alluded to earlier. This can cover things required for education or work, such as uniforms and interview outfit, required tools, and we're proposing to increase that from $400 over a 12-month period to $600. Vehicle repairs, again, you need this vehicle to get to work. Currently, we can assist, again, and this is for Kentucky Works program participants who are in KTAP, just want to make that clear again. They can obtain $1,500 per household over a 12-month period, and we're proposing to increase that to $3,000 because honestly, if you've had a vehicle repair recently, $1,500 does not get you very far. And then we are proposing to increase our assistance to cover the cost of required fees needed for your employment. We're proposing to increase that from $200 to $400, and that might look like a licensure fee, training registration, lots of examples where that may be needed. This program, through the Kentucky Works program, there's also an educational bonus available to participants. It's currently $250, and we are proposing to raise that to $500. And examples where an individual might obtain that is if they get their high school diploma, GED, post-secondary degree, and it's just kind of an incentive stating that, we believe education is key in obtaining and maintaining employment, or, pursuing promotions and things like that. So incentive there. Are there any questions about these programs?
Anyone have any questions on this? Do you? Representative Dixon.
Yes, ma'am. Thank you for the presentation there. I do have a quick question on the Kentucky Work program. How many participants are participating in that program currently? I noticed in the notes it was, I think, 3,360 or so are in the KTAP program, families, individuals. How many of those are participating in the work program?
Sure. So I'll let Todd give a little more details. Right now, it's about 400 participants. I'll mention that, we give the number of adults participating, but you have to keep in mind, too, that some of those may be non-parental caregivers. Todd?
Yeah, where was that?
Can you turn your mic on, please?
Yeah, when we say 3,360 adults, so if an adult is in the benefit calculation counted in the household and they don't have a disability or meet another exemption, then they are determined to be quote unquote a work eligible. At that point in time, they go into our count as far as the participation rate, and they are mandatory for participation in the program. During the pandemic, the participation's been lower. We've been counting. We have not been. There's actually been we haven't been sanctioning individuals for non-participation. Let me put it that way. And so we're picking that back up right now, and so the participation for those work-eligible adults should begin to go up now that that's happening.
A quick follow-up. You said sanctioning those individuals for not going back to work. On that, is there something that tells you that there is that requirement, or is that something that you are doing internally with that program as those individuals go into that program?
I'm not sure I'm following.
I guess my
the
question is, you'd said there was approximately 400 participants in the program, and then you had made the comment that with COVID and the pandemic that you've had less participation from those individuals who were, able-bodied that could go to work out of those households. You'd had less participation in that, and you haven't quite impressed upon the requirement. Is there that requirement? Is that a regulation? Is that law?
Yes, that is a requirement, and
Okay.
they are notified of that requirement.
Do they lose their benefit if they do not fulfill that requirement?
Yes, their benefit can be reduced, either ratably reduced, prorated, based on their percentage of the benefit if it's an adult with children in the household. If it's a two-parent case right now, they can receive what's called a full family sanction, and basically the whole benefit's terminated.
I got you. Okay. Thank you.
I have a follow-up to Chairman Dixon's question. Can and are, sometimes there's a very fine line that separates those, and sometimes there's a gulf. Just because benefits can be reduced or taken away, are they? And how is that determination made? Walk us through how that works.
Yes, very often they are taken away, and especially in terms of that full family sanction I just mentioned, and it.
Hang on just a second. You've got really good stuff. Get a little closer to that mic so everybody can hear you.
I'm sorry about that. Are we there now?
Yeah, thank you.
Yes, it's a process. We have case managers in the field that work with, in the field, I mean in all 120 counties, that work with this caseload. And so they assess this caseload and make a plan with the individual and then follow through on that plan. And if appointments are missed or attendance in an activity or a job is missed, then they're going to follow up with that individual. It's a process we call conciliation. And so they're going to go through that process, figure out what the challenge is. Was it a sick child? Was it your transportation fell through or your child care fell through? What happened? They're going to try to work through that. If that's not possible, then yes, it can absolutely wind up a sanction will occur, or a full family sanction, which means the whole benefit group is discontinued.
And in fact, that process is kind of part of the workforce development and making more consistency in their lives where people can go and hold a job productively. That kind of reinforces some of the life skills that they're going to have. This isn't something where benefits are just taken immediately upon noncompliance. There's a pretty good workout period, I guess, is what you're talking about.
Exactly. I mean, that is what we're shooting for. If somebody is, as Laura said, these are the, sadly, the, lowest income, poorest folks in the state. Mm-hmm. And so they really need our help. And so when we take that case management aspect of it very seriously, and we have the referrals we make, the plan we come up with will address those things, right? There will be soft skills included in some of that training, just like you said, on how to keep your job, yeah. Right? So you're going to have a boss when you go to work, those kind of things, right? You need to set your alarm. Some of the basics you wouldn't think you would have to talk about, but I was a case manager for 10 years in the field, so I know that's exactly, and it really does help a lot of folks, and we've helped a lot of people since 1990 with this program, so I'm glad to talk about it.
Kind of a follow-up for another Chair Dixon's questions. You were working through the TANF child care assistance, and I noticed in there was, I believe, 770 children that were receiving some sort of child care under this. And then there's over 10,000 children involved. To me, that seems low, just statistically. There's lies, damn lies, and statistics. Statistically, that seems low. Can you explain kind of where the gap is on that?
I can't speak to where the funding is. point being, I'm not sure that means none of those other children are receiving child care. Because there's a lot of child care funding out there right now.
So is this something that some of this bandwidth could be taken up by other programs?
Yes.
Because I think, without speaking for him, is the crux of my question and some of the discussions we've had is we know we have these issues, and child care for people entering the workforce or already in the workforce is a major component of this. And we see this option here, and I haven't done the numbers, but it's a really low percentage of 770 and over 10,000. And we want to make sure that there aren't avenues in place that we just aren't fully utilizing to help address some of the things that are the issues we're focusing on this task force.
Well,
so that was kind of my reasoning for asking that question.
Well, that number of all children, of course, that's anyone under the age of 18, so they may not all be, daycare, childcare age. But also, yes, other children would be covered by our CDF funds mentioned, Child Care Development Fund, through our Child Care Assistance Program. So it's very well many of those children could be paid with those funds instead of TANF.
Kind of a follow-up on that. Is there any real need or way to coordinate that to see if we could have the greatest deployment of child care options? Is there any way to talk between agencies or coordinate between agencies for any of this?
Actually, eligibility for those child care programs is done by the exact same workers in the field.
Yes. And both of those, DCBS administers both of those. Those are both divisions under DCBS, so there definitely is a lot of communication there.
Is there anything in that arena that you don't have that would help with that coordination and placement? Put you on the spot. You don't have to answer that at this point, but sometimes you talk about things and he left you on an island out here.
We may have to think about that one.
Yeah, thank you. One last thing, Ms. Bacon, you had mentioned about there were 11 regulations and 9 of them were in compliance. So those are the ones you were dealing with. Not now, but is there any way you could just circulate that to somebody so we could review those too, just to kind of see where you were on some of that stuff?
Yes, sir, definitely.
Right.
The regulations compiler staff with LRC, they could definitely make those available, and I will touch base with them.
Great, thank you. Anyone else have any questions on any of this? Well, we thank you for your time. Appreciate all your hard work on this.
Thank you.
Our next meeting, it's our last meeting, is scheduled for Wednesday, November 16th at 11 o'clock. We will be discussing and approving findings and recommendations. At that point, I encourage all of our members to look out for information that we're going to be circulating toward this, have some discussions. If you have any ideas or questions, circulate them through, contact Chairman Dixon or myself. And with that, the meeting is adjourned.